Welcome back. You're listening to part 2 of the discussion, Coronavirus, the Need for a Vaccine Credential, sponsored by MITRE on Federal News Network. I'm your host, Jason Miller. My guest today, Dr. Jay Schnitzer, the Vice President and Chief Technology and Medical Officer at MITRE, and Sandra Beatty, the first Deputy Director for Budget for the state of New York. Sandra, before break, we were talking a little bit about the security and privacy piece, and that's where I want to start. Because as you said, sometimes people don't understand the technology, they don't understand what it means, how it works. So give me a sense, how's New York addressing those two concerns? Because I could see somebody saying, I don't trust the state of X, whether it's New York or somebody else, with my information. And Jay, I'm going to ask you to weigh in afterwards because you'll give the broader technology perspective of the beauty of the QR code now. But Sandra, lead us off.
So data privacy has been at the top of our minds since we started this journey, and it's a cornerstone on how we develop the Excelsior Pass. As part of the journey, we interviewed many data and privacy experts, including individuals from our state equity task force, to factor in the best opinions of how to go about this. And the Excelsior Pass limits the amount of personal information required. We have a QR code. However, within that QR code, it really contains your name and whether or not you are vaccinated or not. Doesn't say what type of vaccine you received. It's a true, false, yes, no. There is nothing in there that limits or provides individuals with personally identifiable information that you wouldn't ordinarily have already in your personal wallet or billfold, which really is your first and last name and your date of birth. With the QR code is the only three things that will appear on the Excelsior Pass itself. We also, from the very beginning, have talked about to what extent should we be maintaining any data, whether it is the business itself who is scanning the verifier and verifying the QR code, or if it is us, the state of New York and the Excelsior Pass. And I'll tell you, to the chagrin of our developers, we have such little information and data available that it's making it difficult to stay ahead or come up with bugs or fixes to the actual program. You know, at the end of all of this, this really was a digital replica of the CDC paper card and a way to provide another form for individuals who will lose it. I can't tell you how many times I have conversations with people who their stomach drops because they can't find their social security card. It's becoming the same feeling with your CDC vaccination card. Even for myself, I keep it in my kitchen junk drawer. You know, that's the safest place. But so, you know, look, it's all about having a two-step validation and verification, even when the individual goes to sign up and receive their Excelsior Pass. And we give them the option, similar to a boarding pass, of you can put it into your Excelsior wallet, your native Apple or Google wallet, or you can print it off of your home computer, and you never even have to use the digital pass.
So, Jason, I think Sandra's raised a number of really important points here. One certainly around privacy and preserving confidentiality and HIPAA-based restrictions on clinical data. Having a minimal data set is a very good way of organizing that, and having no central repository of vast expanse of clinical data is spot on in terms of managing those concerns. But for other kinds of issuers in the future, that might not be the case. They may have large amounts of data, such as healthcare providing systems that also want to provide a credential. And then future state, for this kind of technology, we now know how to preserve privacy, preserve confidentiality, preserve control and access to that kind of data, and let the individual have control of what they have access to and what they can share including other elements based on their electronic health record or other sources of data. And that's a future state, not necessarily right this minute for COVID, and certainly not necessarily for vaccination status, but for future uses of this kind of technology. Those opportunities exist for the future. And then the second point she made, which I think is really, really important, and we want to emphasize and re-emphasize, is that you don't have to have access to high tech in order to take advantage of these capabilities. You can print out the QR code on a piece of paper and use that. And so this is all about equity. This is all about having access to this capability, regardless of whether you have a smartphone, regardless of whether you have a tablet, regardless of whether you can afford it, and regardless of whether you know how to use it. So I think we need to make sure that the playing field is level for everybody in these technologies. And that's just what the state of New York has done.
Yeah, Jay, I think one of the things that I also would pick up off of that you're also alluding to is setting clear and consistent data standards. And to the extent that we can drive a federal conversation of the national standards in this space, it will help mitigate sort of a patchwork quilt being developed across the country. And this includes also for the scanner app itself, in addition to the passes, right? So to the extent that they can all have data standards where they're recognizable, a QR code, one of the things that we're noticing relative to any of our passes that are not valid scans is because a non-Excelsior pass scanner is trying to scan the QR code. So that means the technology is working, in that if you are not using the Excelsior scanner app, no separate type of technology or scanner can scan our code.
Now that does open the door. I know we're not having necessarily a big tech conversation here, though. Maybe Jay could jump in here. Is the open standards? Then you mentioned the data standards. You also need technology standards behind this. So Jay, maybe weigh in on that a little bit, and then Sandra, I have another follow-up for you.
Sure.
Yeah, so I think Sandra's exactly right. We need national standards and norms. The basis for that exists with the ongoing work that's been going on for a number of years around HL7 and fire-based applications and smart on fire, and the standards that are accepted by the industry now for those and going forward and being built upon them. So that foundation is there. We need to make sure it's intact and make sure that everybody's playing to the same sheet of music. Some folks would prefer open source, some like proprietary technologies. We're agnostic on that subject. I mean, both have their place and need. So we want to make sure that they can coexist in the ecosystem, but they all need to be standards-based and share the same standards, so that the interoperability question becomes moot, because then if you have the same standards, you'll have the interoperability going forward and the ability to extend beyond. So it won't just be you develop the answer to this problem and now to solve the next problem, you got to start all over as if you hadn't learned anything from the first one. So we'll be able to expand upon it. And that's the direction we see the field going.
And to pick up on Jay's point, I also would say, the data and the underlying data itself, right? You have to operate under the assumption that it's accurate, and it is not always the case. We're even finding that within our own immunization database. And, it's because there are many feeders. This was an immunization program that multiple channels were able to immunize, unlike prior instances, whether it was a childhood immunization, which mainly happens at the local government level, or your provider. We have the pharmacies, we have the federal programs, we have the state programs, et cetera. And with that has even led to its own challenges, because as of this date, we and every other state do not have access to any of our residents who were vaccinated in a federal program. And that is something where, when you're talking about public health and going through a pandemic such as our nation and our international partners have gone through. And we're now starting to open back up across the country. We're also starting to see Europe opening up. With that, we know that the virus started overseas when it landed in New York. So, this is something that has no borders or no boundaries. So at some point, we also need to solve this issue of the different capabilities and visibility into residents and individuals' public health records, which everybody is entitled to.
Sandra, I want to just talk real briefly about what the use of this vaccine credential today opens the door for the future. You all mentioned it earlier on in our conversation. What does New York see or hope for that, okay, once we get comfortable with the technology and the policy and the transparency pieces, what could this mean 3 years from now, 5 years from now?
Right now we're squarely still focused on completing reopening the New York economy. The time will tell as we get into the fall and big business brings back their workers into the actual workplace. We also will see the influx at the end of the summer with college students returning from various parts in the country, right? So we're focused on those areas with driving utilization of the Excelsior Pass for the overall good of the public health. And again, I just want to stress it is voluntary. It is about ensuring that for the good of the public health, that we do not have any pop-up or breakthrough recurrences. The experience has really taught us that there's a tremendous amount of power and impact if you do technology right and smartly, and that you gain the trust of the citizens who we're responsible for, right? When something winds up being compromised, that will drive the conversation in a different perspective. We have no indication thus far of anything relative to security issues, but with the use of cell phones, we are an increasing digital society. And generationally, our government needs to reflect and drive that conversation more broadly to meet the demands of delivery ahead for the generations that are tech savvy and expect everything at their fingertips. In the longer term on the horizon, we created the Excelsior wallet, which is the New York State native wallet, akin to your Apple wallet, so that we can put additional passes that are critical to New York State residents into that wallet. So it's one-stop shop for an individual, and you don't have to keep remembering where is your paper, looking for a PDF, scanning your phone, etc. And I know Jason's kind of smiling at me because I know we've all done it, right? So, whether it's go ahead, Jason.
If you have kids, you have to get their vaccinations, that. But Sandra, Jay, unfortunately, we are out of time, and this has been a great conversation. Obviously, we could have talked a lot longer. So let me thank my guests. Dr. Jay Schnitzer is the Vice President and Chief Technology and Medical Officer at MITRE. Jay, thank you so much for taking the time today.
Thank you, Jason. Enjoyed it.
And Sandra Beatty is the first Deputy Director for Budget for the State of New York. Sandra, thank you for taking the time as well.
No, thank you, Jason and Jay. Appreciate the opportunity.
I'm Jason Miller, and you've been listening to part 2 of the discussion, Coronavirus, the Need for a Vaccine Credential, sponsored by MITRE on Federal News Network. For more on this discussion, visit federalnewsnetwork.com and search MITRE.